Good morning, good morning. It is a rainy day this morning and I just arrived to my clinical site. I actually have a site visit today. So what that entails is my clinical advisor is going to come in and evaluate me with my patients just to see my interactions, my teaching, my knowledge level, and my hands-on skills. So I'm like so nervous about it. I know, I don't know. I don't know why I'm so nervous. I have like anxiety. My stomach has been hurting for like 2 days. I don't even know. Like, I'm normally very confident when it comes to seeing my patients, but just the fact that I know I'm not being graded, but being assessed and watched. Especially by somebody new. I'm normally okay with, my preceptors and everything being there, but she's new and I've actually never met her before. I talked to her on the phone, video conferences, and through emails, like weekly or bi-weekly. She's absolutely awesome from what I can tell, but I don't know, nerve-wracking. So I'm just sitting here. I'm going to say a quick prayer and I don't know. My mom texted me this morning and basically said, pretend that she's, one of my students, when I'm at work and I'm teaching her. So maybe that'll work. So if I pretend that I'm teaching her what to do, it'll make me feel more confident and, get along with my visit. So she's going to see me with like maybe 3 to 5 patients. And then we'll meet up. She'll meet with my preceptor and then, go from there. I just hope this goes by so fast. Well, I'll update you. I'm on my way in there now, so don't want to be late. Wish me luck. Hey y'all, so I am back and my site visit is over, and you know what, it wasn't even that bad. Like, I was stressing over something that I shouldn't have really been stressing over. It wasn't a real critical evaluation. It was still nerve-wracking to have somebody there watching you and critiquing your every move and everything, but it wasn't as bad. It wasn't like she was butting in and changing the plan of care or anything like that. She just wanted to see how I interacted with the patients, if I came up with any differential diagnoses, if I can establish a plan of care. It's not that I'm not confident in the care that I can provide or the knowledge that I have, but it just makes you nervous, and when you're nervous it kind of throws you off. You might forget to ask something that you would normally ask. So I was just hoping none of that happened. She evaluated me with 2 patients. One actually came in for a well woman exam and wanted to discuss birth control options, and the second patient was a return OB. So she was 40 weeks, and we were supposed to have 4 in the office, but 2 of them didn't show up. So yeah, it was supposed to be anywhere between 3 and 5 patients, but like I said, they didn't show up, I guess because it was raining this morning. I still had a busy afternoon. She stayed. She met with my preceptor. She met with the director of Midwifery and just kind of talked to them about my progress and where they see me going from there, and if they would be comfortable signing off on me, because I am so close to the end, you guys. I cannot believe it. I had really good feedback, not only from her, but from my preceptors and the director. The only really critique that they have for me is that I'm too quiet. I obtain all the history and give patient education and teaching, but after that, I'm not really talkative. That's hard to believe, right? But yeah, that's just how I am. So they want me to work on building the relationship with the patient. Even though that's my goal, I don't know how I'm going to do it, because talking to strangers is just not my MO, and I don't know how I'm going to get past that. Well, at least enough for me to finish this clinical, but you know, I'll definitely work on it. I don't have a problem with building relationships for my work as an RN, because I'm there, you know, with that patient for 12 hours or patients for 12 hours. But this is someone that comes in the office and it's about a 15 to 30 minute visit. So, you know, if I see these patients on multiple occasions, then, you know, the interaction is different. But if they're new, I kind of just do what I need to do, make sure they're educated, agree with my plan, and that's pretty much it. Yeah, so I'm on my way home and I'm so excited. Like, today was my last day in the office. Like, no more office visits. All the rest of my clinical time will be focused on inpatient, labor management, and delivery. So I don't have that many more to do. I'm on the countdown. Like, seriously, you just don't understand how much I want this to be over. But yeah, let me focus on getting home safely. So I will talk to you guys later. All right, so I'm settled and I am tired. I got home, I cooked them dinner, got the kids in the bed, and I just have some clothes in the laundry. I have to log my patients in the system, start on a little bit of homework, and answer some emails. So that's basically what I'm doing tonight. So late, everybody is asleep, but this is, you know, when I get things done. There are no kids around, running around, screaming. You know how they do. You hear them in my video background. So yeah. So yeah, I just came into the office. Right now, like I said, I need to answer an email really quick. I need to okay approve of one of the new t-shirts. Oh, shout out to everybody who bought a t-shirt. And if you haven't, check out the website. Yes, I'm getting a new t-shirt and a mug. So yeah, I need to answer that really quick. Just want to make sure it's the correct design and script. Gotta make sure that font is right. But yeah, this one is really cute. I like this one. I hope you guys will like it too. But yeah. So that's done. Let's go ahead and log these patient cases in here. So all the patients that I saw today, I need to log them in the system so that I can get credit for them. We didn't have too many patients this morning, but we got a couple this afternoon. It was sort of busy. I had like 2 well woman exams, mostly prenatal appointments. I had someone come in for vaginal discharge, ended up being BV. And another patient that came in for preconception counseling. So yeah, it was pretty busy, but I enjoyed it. I really, really love the office, and it's so bittersweet that, you know, it's over now. That has actually been my favorite part about clinicals. But it just means the end is near. Oh my gosh, I can't believe it. So yeah, let me throw these patients in here. This is the most tedious part, like putting in all these patients and what you did for them and what medications you prescribed, putting in the codes for them. Oh my goodness. ICD-10 codes. So you basically, so you can get paid for your services. I mean, granted, I'm not getting paid because it's a clinical assignment, but if I was a real provider, you would have to charge for your patients. So basically putting in their demographics, what type of visit it was, what type of care provided as far as the ICD-10 codes, medications, and that's really it. So I'm gonna get started on this. It's gonna take me a good 45 minutes or so to put this in. So I'm gonna go ahead and jump off here and make sure I get this work done. I like to be thorough and make sure I don't miss anything because I want full credit for everything, okay? Yeah, that's about enough time until the laundry stops and then I can go to bed, but I will talk to you guys soon, so thank you for tuning in. Don't forget to subscribe, follow me on Instagram, and hit your notification button so you know when I upload again. And until next time, you guys, stay focused, stay fabulous.